He worked the night shift as a janitor. Nobody paid attention to him, until the young doctor in the ER panicked and called for help. The old man quietly approached, removed his gloves, and the deep surgical scars on his arms began to show. But these weren't ordinary scars. These were marks that only one kind of person could carry. Welcome to Quiet Heroes. Before we begin this powerful story, tell me in the comments which city you're watching from today. And if you believe stories like this should never be forgotten, hit that subscribe button and help us keep remembering the forgotten heroes. The night shift at City General Hospital is quiet. Only the echo of footsteps in the corridors and distant monitor beeps fill the air. While the ER nurses wait half asleep, janitor Marcus silently does his work. Marcus is 67 years old, gray-haired with slightly stooped shoulders. Every night he starts his shift at 10 p.m., works until 6 a.m. Nobody talks to him much. They pass by saying, "Good evening, Marcus." He nods back in response. As he pushes his cleaning cart, his steps are slow but determined. His gloved hands move the mop with care. His eyes always on the ground, silent, invisible. For 15 years, he's been cleaning the same corridors, the same rooms, the same waiting areas. Never complains, never late, never leaves early. Young doctors barely notice him. Resident nurses sometimes say, "Thanks, Marcus," but most times he's already gone before they finish the sentence. Invisible, silent, just doing his job. But tonight will be different. Tonight, Marcus's hidden secret will be revealed. 2:30 a.m. ambulance sirens approach the ER. Dr. Sarah Chen, 28 years old, in her second year as a resident doctor. She still gets nervous when left alone on night shifts. The ambulance doors open. 2 paramedics carry in a 35-year-old man on a stretcher. Car accident, chest trauma, suspected internal bleeding, pulse dropping. "Room 3, Sarah shouts. She puts on her gloves, but her hands are shaking. She's never handled such a severe case alone before. The stretcher enters the emergency room. Sarah quickly checks vitals. Blood pressure 80/50, pulse 45, shallow breathing. This is bad, very bad. "Call the ICU team," she shouts to the nurse, but the nurse isn't in the corridor. Sarah is alone. The patient's condition is deteriorating. "Need help?" Sarah turns around. Marcus is standing by his cleaning cart. His eyes are no longer on the ground. He's examining the patient. "Marcus, not now, please," Sarah says while changing her gloves. Marcus approaches, slow but determined. "Did you check his pulse?" he says quietly. Sarah is surprised. Yes, it's very low. Marcus removes his gloves, and in that moment, Sarah freezes. Marcus has deep, old surgical scars on his arms, but these aren't ordinary surgical scars. These are war wounds, shrapnel marks, and most surprising, the precision in his hands. "Surgeon's hands. I can handle this," Marcus says, his voice now carrying a different tone. Authority, experience. Sarah hesitates. "Marcus, you're just a janitor." "I did field surgery in Afghanistan, Iraq for 15 years, Marcus says, now beside the patient. "Under tents, between bomb sounds, in conditions much worse than this." Sarah's mouth falls open. Marcus is now someone else. His hands quickly examine the patient's chest, finding pulse points, his eyes scanning the monitors. Internal bleeding. Air buildup in the left lung. Immediate chest tube needed, Marcus says with no hesitation in his voice. "But you're not a doctor." Marcus looks at her. No more helplessness in his eyes. Dr. Marcus Thompson, trauma surgeon, retired colonel, medical corps. Sarah's world changes. But why? "We'll talk later," Marcus says, washing his hands. "Right now, let's save this man." Marcus is now completely someone else. The identity he's hidden for 15 years is revealed. His hands quickly prepare the patient's chest. Sarah assists him, but the shock doesn't pass. Sterile gloves, 14-gauge needle, local anesthesia, Marcus says, his voice calm but decisive. Sarah brings the materials. "But how do you learn in field hospitals," Marcus says while preparing the needle. No electricity, no proper equipment, just your hands and experience. He begins the procedure. His hands are robotically precise. Sarah has never seen such precision. What she learned in university pales in comparison. In 2003 in Baghdad, Marcus says while working, we did 20 surgeries a day, standing for 12 hours. Then a mortar shell would come, we'd move the tent and continue somewhere else. The patient's color improves. Pulse returns to normal. Breathing eases. Why did you quit? Sarah asks. Marcus pauses. I didn't quit. I was retired. PTSD diagnosis, tremor problem. He looks at his hands. But at night, here, when I'm calm, my hands return to their old state. After the patient is stabilized, Sarah and Marcus face each other in the corridor. The ordinary janitor is no longer there. Standing before her is a man who has saved dozens of lives, a surgeon. Why didn't you tell anyone? Sarah asks. Marcus gives a tired smile. What would change if I did? My license is revoked. I have no medical malpractice insurance. Technically, I just performed an illegal intervention. But you saved a life. I've saved hundreds, Marcus says quietly. In Afghanistan, in Iraq. We set up operating tables under bombs, did CPR under mortar fire. My hands were stained red with my friend's blood. Sarah listens, her eyes filling up. Then when I came home, Marcus continues, my hands started shaking. I couldn't sleep at night, started having panic attacks in the OR. I surrendered my license. So why do you work here? Marcus looks at the hospital corridors. Because I couldn't stop saving lives. I can't operate, but at least I can keep these corridors clean, make the doctors' jobs easier, quietly. The next morning, when Sarah's shift ends, she talks to the attending physician about Marcus, then to the head nurse, then to the hospital director. Dr. Thompson, the director says in surprise. I know that name. He was a legend in the military medical corps, Bronze Star recipient. Veterans called him Golden Hands Thompson. From that day on, everything starts to change. Marcus still does janitorial work, but now doctors look at him differently. Not just as a janitor, but as a former colleague. Dr. Adams, a former military doctor, approaches Marcus. Thompson, right? Marcus nods. We worked together in Ramadi in 2005. Was that you who did 7 surgeries in 14 hours in that field hospital? Marcus just looks, silent. I'll never forget that day. Under mortar fire, power outage, just flashlights. You did impossible things under impossible conditions. As days pass, Marcus's situation changes. He still does cleaning, but now in emergencies, doctors seek his advice. Unofficially. One night, young intern doctor Kim gets stuck on a difficult case. Marcus quietly approaches. Look at the x-ray again, Marcus says. There's a shadow in the lower left lobe. Could be a missed injury. Dr. Kim looks again. Marcus is right. They missed a small pneumothorax. How did you see that? 40 years of experience, Marcus says. Some things are never forgotten. Nurses start treating Marcus differently. They no longer say janitor. They don't say doctor. Thompson either. They just say Marcus, but with a tone of respect. A month later, a quiet change occurs in the hospital. Marcus still does the same job, but now doctors see him as a consultant. Unofficial, off the record, but real. The hospital director calls Marcus to his office. Dr. Thompson, the director says, I've learned about your situation. I have an offer. Marcus waits. Medical advisor position, part-time, mentoring night shift doctors, unofficial but official salary. Marcus shakes his head. Thank you, but I like my cleaning job. Why? Because nobody expects miracles from me. I just clean, but when needed, I can help quietly. Marcus still works the night shift, still cleans the same corridors, but now everyone in the hospital knows him, not just as a janitor, but as a former war doctor. Young doctors now ask him questions. Marcus answers, but never boastfully. never telling his past. What does it take to be a doctor? An intern asks. Leave the ego behind, Marcus says. Saving the person should be the only goal. Title, money, fame. The patient doesn't care about those. One night, when Sarah comes to her shift, she finds Marcus in the operating room corridor, in the old OR, no longer used but still kept clean. Do you miss it? Sarah asks. Marcus touches the operating table. Every night. But this is also a kind of service. Different, but still service. Do you regret it? Marcus smiles. Regret is a luxury. I just keep doing what I can. Marcus's story shows us that real heroes aren't always in uniform. Sometimes they hold mops in hospital corridors, sometimes they never speak, but when needed, they act quietly. Have you ever met someone like Marcus, someone who seemed ordinary but had an extraordinary past? Share their story in the comments, because at Quiet Heroes, we keep remembering the forgotten heroes. Thank you for watching. If this story touched you, subscribe and share. We'll see you in the next story. And remember, sometimes the greatest heroes are the quietest ones.